good afternoon. You know, we all have personal experience with healthcare, and we all trust that healthcare providers would know what they're doing, provide good care for us, and also doing it at a price we can afford. But in reality, this is not always the case. So there are issues that facing today's American healthcare, and issues that you are thinking right now probably related to one of these three aspects. Quality. This is about whether services that you receive are reliable, effective, and also produce desirable outcomes. And then the next one is whether people do have access to care when they need to. And then the last one is about affordability. Is that affordable for the patients or other payers, including employers? These issues are related, and which make it very difficult to find solutions that address all those problems. Let me ask you, what do you see when you see this picture? You see a pharmacist in a community pharmacy. Well, I see deeper than that. I see a potential solution to address healthcare problems. And why? Pharmacists are one of the most trusted healthcare professionals, according to Gallup poll. Second, if you think about it, pharmacies are readily available because of their convenient location, and also they open, pharmacies open at extended period of time and weekends. And also you do not need appointments to speak with a pharmacist. So they are available to help with your healthcare needs. Also, when researchers repeatedly show that when they include pharmacists in the healthcare team, patient outcomes improved at the same time as we can reduce the overall cost of care. So it is my pleasure today to introduce you to the two projects that we are doing at Auburn. Both have used pharmacists as a core component to increase access to care. The first one is about pharmacists' role in immunizations. So let me tell you why it is important here. First, immunizations rates are now below national goals, and that in 50 states now, pharmacists are authorized to administer vaccines. The law varies from one state to another, but 50 states, pharmacists can do it. And third, you may not know this, but pharmacists can help improve immunization rate. And this is because of their convenient location. They tap into a different group of population, the population in which may not be otherwise vaccinated. Just briefly to show you about why we need to increase immunization rate. The yellow zone represents the current coverage. And then the green zone is the difference between the current coverage and the target rate that's set by the federal government. The first one is pneumococcal vaccine, which is a relatively common vaccine. The first bar is for younger adults, and then for the older adult for the second bar. As you can see, there's more work need to be done for the younger adults. The next one is shingles vaccine. 60 years old or older should get shingles vaccines. And you can see that vaccination rate is really low in that particular vaccine. The next one, same story for adults vaccination, 18 years and older for influenza vaccine. And then we have newer vaccines now is HPV for adolescents, and then there's catch-up period. But we want to start early as possible. So if you look at 13 to 15 years of age, vaccination rates are still pretty low, especially among male adolescents. So just to summarize here, vaccination rates are low, and pharmacists can do it. So, and then you can say, well, what are we doing here? Pharmacists are already doing a bunch of immunizations. You see the ad when you walk into a community pharmacy, right? I would say yes and no. Based on my experience working in this area for over 10 years now, yes, pharmacists are providing vaccination services, meaning they have it in stock. If you ask them to administer a vaccine to you, they would do it. But if you ask them the extent to which they're doing it, it's still pretty low. Generally speaking, we have done the research. Pharmacies, typical pharmacies would do about 25 doses of pneumococcal a year, meaning 2 doses of pneumococcal vaccine per month, which is pretty low when you consider number of high-risk individuals who are high risk for pneumococcal disease. And then we study as to why this may be the case that they're not doing it as much as they could have. And the reason is because they do not really integrate immunization services in the dispensing workflow. And that really means that the system prevents them from assessing immunization status when you pick up medications, and then therefore they do not recommend the vaccines that you should be getting. But we learned, the good news is we learned that recommendations from pharmacists actually do work. When we study community pharmacists when they recommend herpes zoster vaccine, and we look at to what extent patients accept recommendations, and it's pretty good. So that's good news, but the bad news is the implementation, we still need some work in that regard. And that's lead to, for us in our group here, to design the We Immunize program that is currently ongoing right now. We're in the 2 months of intervention. It's a randomized controlled trial. And we look at about 67 pharmacies in California and Alabama. We randomize them. Half of them would get intervention. The other half is a control. And the intervention focus on how do they recommend the vaccine to the patients, and at the same time, how can they integrate the vaccination services into workflow so that when you come and pick up diabetic medication, they would recommend, say, pneumococcal vaccine to them. So that's the first project that I'd like to introduce you. Now I'd like to shift the gear to talk about the second project that also uses community pharmacists to help increase access to care. This one is about Medicare patients. Medicare patients with limited incomes are qualified for subsidy programs. Subsidy programs that will help them pay for Medicare Part D premiums, medications, and sometimes it's medical care. So that really helps them, especially if they have limited income. But the bad news is these subsidy programs are really underutilized because patients are not know about it. They're just not aware of these programs. Therefore, they're not enrolled. Therefore, they struggle to pay for medications or medical care. So we have designed this program, the C.A.R.E.S Pharmacy Program Network, in collaboration with our colleagues at Alabama Department of Senior Services. Basically, this program would use pharmacists as a front line to help identify patients, Medicare patients that potentially eligible for subsidy program, and make a referral to the existing aging network so that the counselors at the aging networks can do screening for benefits. And if they qualify for those, they would help enroll them into the program. And once the patients enroll, they can be able to afford their medications and medical care. So let's just hear what pharmacists have to say about this program.
Hi, I'm Rachel Ebrecht. I'm a pharmacist and a pharmacy manager. The C.A.R.E.S network is a program aimed to help Medicare patients. I'm sure we've all had customers that we'd love to help more, so that's what C.A.R.E.S does. It helps you aim them in the right direction to get the benefits that they need. It's really easy. All you gotta do is fill out a form. Paperwork is prepaid, so all you have to do is just fill it out, stick it in an envelope, and send it in. I highly recommend other pharmacists use the C.A.R.E.S network. It's super easy to use, and it's a very efficient way to help our patients.
You can go to our website to look at our network, alpharmacycares.org. But so my takeaway point here is that don't delay, get to know your pharmacist today, and while you're at that, get a flu shot too. Thank you.